we call it as a red flags, like
Yeah,
this is the
exactly.
situation where we need to get in touch with your health services. So again, injuries and medical illnesses that will help us to, so falls which are significant. So how do you say a fall is significant? Like a child which fell down from a 5 feet, but externally child looks fine, but there is associated bleeding from the nose, bleeding from the ear, or there is a fracture involving any extremities or a depressed fracture in the head. That means there is a significant fall is there. Okay. So what happens to this child? They tend to be unconscious. They may be more sleepy than usual. They may have got episodes of vomiting. So these episodes of vomiting are because of the increasing pressure in their head. The intracranial pressure increases. So this is one part. Second, if there is a fall on the chest or abdomen, externally it looks fine. There is just a bit of bruising that we can see, but suddenly the child start appearing very pale and become cold and clammy. That means there is an internal injury. So these are visible and non-visible effects of fall that we can see. If you go to the next common injuries that we see is burns. Now, any burn which is involving more than palm size of the area of the child, like if you see the palm of the child and just compare the area of burn, if that area of burn is more than size of the palm, that means it is a significant burn. Second, burns which are on the face involving eyes, or there is no direct burn to the child, but child was in a close vicinity where there was burn, and child has taken the so much of carbon monoxide, carbon dioxide that is coming out of the flames, and the child is drowsy out of that. So this is the effect of the burns, which may be direct or indirect effect, and in that situation you need to get in touch with your health services. Next, if there are any bites, or it may be a scorpion bite, or maybe a snake bite, or it may be some bee sting which is contributing for local swelling, redness. We have seen some babies coming with snake bite and they are totally kind of paralyzed situation. We call them like a neurotoxic snake bites. So this is another situation where we need to get in with the emergency services. In allergic reaction also, we do get babies with swelling all over body, itching sensation, breathing difficulties. So we need to connect with your emergency services. So these are all injuries where you need to get in touch with your emergency services. Now going forward to the underlying illnesses causing problem, like a child who is on treatment for asthma and then suddenly start getting breathless. So that means the child is not able to breathe comfortably. If you ask the name of the child or if you ask anything, he won't be able to complete sentences. Like, like he will say one word, he'll take breath. He will say another word, take breath. So that means the difficulty is severe. This is how you identify the problem is a critical problem, and then you can take help. And as I told you earlier, like we have seen diabetic ketoacidosis where the sugars are not, the insulin is not taken on regular basis. So sugars becomes uncontrolled and these babies tend to get with dehydration and then acidosis causing fast breathing. If someone who is having history of convulsions, fits what we say in normal words. So first of all, let's try to understand whether it's a normal jerky movement or whether it is fits. Like, if someone is shaking the hands, if you hold their hands, it stops. That means it's a normal jerk. But someone who is shaking their hands and legs, they're uprolling their eyes, and if you try to hold, the movements are not getting stopped. That means it's a fit or it's a convulsion. So in that situation, nowadays, for someone who is having history of fits, we do give home remedies. We give them the midazolam spray. You must have heard of this medicine, midazolam, that is for convulsions, that is for fits that we use in hospital services. But with advances of the facilities, we have got sprays. You must have seen nasal drop that we put whenever there's a blocked nose. So similar sort of sprays are there that we can put in the nose of nostrils of the baby. So that helps to control the convulsions. So these are what we need to look at the signs, symptoms, and then get help of our emergency medical services.